The following audio-supported podcast is intended for informational and educational purposes only and is not intended as medical advice. Please speak with your healthcare professional before making any treatment decisions. The guests on today's show were paid to participate in this podcast.
All right, Cheat Codes listeners, it's me, Dr. Z, and Dr. C is with us as well. We are here with a really special guest today. I've got a soft spot for this guest in particular, not only because he's from our hometown state, it's down the road from us actually, but because Dr. C and I got to work with this guest's mom when we were in clinic in Detroit at the Sickle Cell Center and have just been able to watch the unfolding of the project that this guest has worked on really up front. We sort of had courtside seats for the whole thing, and it's been absolutely spectacular to watch that come to fruition. We thought it would be a wonderful idea to highlight this effort on Cheat Codes. So with us today is Shayan Siddiqui of MiCaringHeart. Welcome to Cheat Codes, Shayan.
Thank you. Thank you so much for that introduction.
Hey man, look, I've got to say, it's so hard for us to find people that want to give the light and the spotlight to sickle cell disease, to try to make things better for patients that are trying to navigate a really complicated healthcare system. Hats off to you for all that you're doing. And we're going to talk about your project in a lot of depth. But before we get to that, man, what is your connection to sickle cell disease?
My mom is a pediatrician specializing in sickle cell at the Children's Hospital of Michigan. And growing up, I've been able to see a lot of the meaningful work she's done there. And that's inspired a lot of what I want to do and how I want to help people who need it in our community.
Yeah, like I was saying earlier, man, I've had the opportunity not only to work with your mom, but learn from your mom. She's a wonderful sickle cell physician. I can imagine that the topic of sickle cell disease probably came up at home at the dinner table pretty often.
Yeah. So the way we really got involved with it was Michigan's a pretty cold state. And during the winters, we would have snow days often growing up. And on these days, my sister and I would go to the hospital with my mom, spend the day with her. And one thing we would notice is that a lot of her patients with sickle cell wouldn't be able to come to their appointments. And that's first of all where we learned about sickle cell. And then when we asked about why they weren't able to show up to their appointments, we learned about some of the challenges a lot of her patients faced and continue to face in our community, which is transportation and more the lack of reliable transportation that a lot of the patients face, because many households in Detroit don't have cars and the public transportation here isn't very big, isn't very reliable. So from that, we started learning more about sickle cell and more about challenges people faced, and we realized that's something we want to help with.
Agios is a biopharmaceutical company that's fueled by connections with patient communities, healthcare professionals, partners, and each other. Building on these connections and the company's unmatched leadership in PK activation, Agios is pioneering therapies for rare blood disorders, including PK deficiency, thalassemia, and sickle cell disease. To learn more, visit us at agios.com. That's agios.com. To join the conversation with other patient allies, follow us on Instagram at Ally Voices Rising. That's Ally, A-L-L-Y, Voices Rising.
It's so accurate listening to you talk about this. I remember my days in clinic and how many no-shows there would be simply for the reason that either they couldn't get to clinic because they didn't have reliable transportation. And of course, this is the Motor City, right? And the Motor City's built for cars. It's not built for public transportation. So it's definitely challenging. Wow, what an interesting way to turn snow days. Most kids spend their snow days on the couch watching YouTube and playing video games. You're out here changing the world on snow days.
Thank you.
That's pretty fantastic. So you and your sister sit down, you think about this, and you're like, you know what? Let's do something about it. Talk me through like the conversations you and your sister had, how this all came to be, how it all started, how you came up with the name.
Yeah, so a lot of the discussions would, first of all, revolve around just what sickle cell is, because that's not a very commonly talked about topic. And that's not something a lot of people are familiar with. So our mom made sure to educate us on that first. And then once we learned about that, we were able to see why they need these frequent medical visits and hospital visits to see doctors. And we realized how important transportation was. So we talked about a lot of possible solutions, Ubers and taxis and that sort of stuff. And we talked to our mom about it. And my sister is 3 years older than me. So she was able to get a lot of work done. She started MiCaringHeart actually and started this initiative, Cabs for Kids, to help with that, where she would reach out to the hospitals. I was always helping her out. I was kind of her little employee. She was really the one who got it started.
I feel that deeply. I have 2 older sisters and I still feel like an employee most days. So Shayan, MiCaringHeart has now been going for how many years?
MiCaringHeart was founded in 2021. So it's been just about 4 years since we started. It started with the Cabs for Kids initiative. And recently this past year, I've been able to start another initiative called Outsmart. So currently we have 2 initiatives.
What is Outsmart? Is that also related to sickle cell disease?
Outsmart is meant to tackle the issue of patients who are diagnosed with cancer or other serious lifelong illnesses, such as sickle cell disease, when they're children. They oftentimes have to miss long periods of school for treatment. And because of this, they can be set back academically and socially quite a bit. So to kind of tackle this issue, Outsmart aims to provide free online one-on-one tutoring for these patients to make sure that they can stay on track and just ready to go back to school and succeed when the time comes.
Wow, that's incredible. I didn't even know about this initiative. That's absolutely fantastic. Dr. C, initiatives like MiCaringHeart, are you curious at all about how Shayan finds support and supports these types of initiatives? I am.
Absolutely. That was my next question, was how do you raise all these funds?
Funds have been raised in many ways. One is through pharmaceutical grants, Genique and Emmaus. Along with that, I've received a lot of support from family and friends and anonymous donors, as well as just people in the community in our city who want to help out these patients who really need it. And one thing that's also been a big help is social media and just a media presence. MiCaringHeart was featured on Fox 2 News, local news station, as well as I try to stay very active on Instagram to spread the message as much as I can.
Yeah, I can't say enough about what you guys are doing. How has the support looked over the last 4 years? Is it climbing?
I would say it's definitely climbing. As time goes on and more people hear about it, there's definitely been an overwhelming amount of support. And it's really good to see how many people want to support the children in our community who really need it. And I would say as the message spreads and it gets bigger, I've also been able to get more help.
That's awesome, man. I'm curious about what idea you have around how many patients you've helped over the last 4 years. I'd love to hear about that.
A lot of patients are repeat users. So I can tell you that on average, there are 40 to 50 rides provided per month. And many times those might be repeat patients or it's new patients, but there has been a lot of people that have been able to be benefited by this program.
So if we turn that into clinical sense, Dr. C, that means that through MiCaringHeart, Shayan and Reem have been able to account for about 40 or 50 sickle cell clinic visits through their initiative.
That's amazing. And I know working in our clinic, transportation was always a huge issue. So many families didn't have reliable transportation, and it's a huge barrier to care.
And if you extrapolate out that math, that adds up to almost 500 extra visits that otherwise wouldn't have happened in a year.
Yeah.
It's absolutely remarkable.
Thank you.
That's a huge impact on the care of patients with sickle cell disease in the Metro Detroit area.
I was just going to mention that I've also been able to spread that not just at the Children's Hospital of Michigan, but also at Henry Ford Hospital. Because one thing I thought about was that these patients, once they turn 18, they do have to transfer to another hospital system. They can't stay in the Children's Hospital system. but that doesn't necessarily mean that they now have transportation. So because of that, I've also been able to donate money to Henry Ford Hospital, to their sickle cell clinic, to make sure there's a continuation of the service.
That's incredible. Incredible. I think certainly the Metro Detroit area expanding out from the Children's Hospital, it sounds like now, into adult care is going to create even more impact.
We do have so much trouble getting adults into care. So it's great to have these centers, but it doesn't mean anything if people can't get there. So again, kudos to you.
Thank you.
What's next?
I would say that spreading both of the programs as much as possible is definitely what I foresee myself doing. I really want to help as many people as possible with these two programs that I currently have. I think that for Outsmart, which is the education program, that is something that's more new and still has a lot of time to grow. And for Cabs for Kids, I think just fundraising more and raising as much money as possible to give as many people as possible access to transportation for their appointments is what I want to happen.
That's fantastic. I got to ask you an obvious question, Shayan. What have you learned about sickle cell disease over the last 4 years that you probably wouldn't have if you hadn't taken on this initiative?
Honestly, I would say, again, just the issues they face with transportation, because it's one of those things you'd never think about. And the reason they need these frequent hospitalization visits is because that's something I learned talking to my mom, that without the services they can get at these appointments, it can cause severe pain and it can further damage their health. So it's really something that's needed. And it's not something I'd ever heard before I started doing this with my sister.
That's incredible. Shayan, look, man, keep up the great work. And
thank you.
People like you in these local sickle cell communities are so tremendously important to what is getting accomplished city to city. We're thankful to have you in Detroit. I know Dr. C, for me at least, it warms my heart to know that there are people working for sickle cell disease in the Metro Detroit area the way Shayan and Reem have been.
Absolutely. Having altruistic young people makes you optimistic about the future.
Thank you.
So for those who are listening, Shayan, if they want to follow you, how do they follow what you're up to?
One way is through our website, MiCaringHeart.com. And again, that's spelled MiCaringHeart. The M is for Michigan. On Instagram, the tag is just MiCaringHeart again. And donations can be made through our website for either Outsmart or Cabs for Kids.
Awesome. And you're a 501c3?
Yeah, so 100% of any money raised goes straight towards these programs. We're a nonprofit.
That's amazing. Shayan, thank you so much for being on Cheat Codes today, man. Keep up the great work.
Thank you for having me.
Tell Dr. Khatib we said hi.
Oh, yeah, I will.
All right, with that, Cheat Codes listeners, go out there and make sure you follow MiCaringHeart. Get on that website. And for anyone who's listening and able to do, go make a donation. Shayan, that was great.
Thank you.
With that, Cheat Codes listeners, keep living well with sickle cell. Follow me at Dr. Z Sickle Cell.
And me at Imagineer.
Be sure to share this episode with somebody who you think could benefit from it. Other than that, we'll see you next time. Peace.